Hello, fellow health enthusiasts. I am Dr. Elena Runchese and I am a master certified pharmacist based in the northeast of Italy. And today we're going to talk about a common metabolic condition, which is insulin resistance. Let's get.
What is insulin resistance? Insulin resistance is defined as a state of reduced responsiveness in body tissues to high physiological insulin levels, and it's considered a pathogenic driver of many modern diseases, including metabolic syndrome, atherosclerosis, and type 2 diabetes. In other words, cells in your muscle, fat, and liver don't respond well to insulin and can easily take up glucose from your blood. As a result, your pancreas makes more insulin to have glucose enter your cells, leading to chronic hyperinsulinemia, hyperglycemia, and eventually type 2 diabetes.
So, what happens to our body in normal condition? Insulin is an hormone and converts nutrients into substances we can use like glucose and fats. Let's have a look at what happens in a state of insulin resistance then. Well, the body is not responding normally to level of insulin. As a result, we see a lot of abnormalities such as elevated glucose in the bloodstream, which is the primary clinical symptom of the type 2 diabetes. Although insulin resistance doesn't present with clear symptoms, therefore it's even more important to spot it in time. Causes. The main cause is carrying extra weight, especially in tissues where they shouldn't be, like the liver. It's exactly this extra fat sitting in the liver that affects how our body responds to insulin. And why is that? The liver is the factory that processes our energy, and extra fat inside the liver interferes with a bunch of body functions as a result. Does everybody have the same likelihood to become insulin resistant? Well, the reality is that the people that most likely tend to develop insulin resistance are the so called apple shaped because they store fats in the upper body, namely in the abdominal organs, interfering with the metabolic functions. What are the implications and common conditions that are presented along with insulin resistance? Well, as we mentioned before, fatty liver, which means the liver is carrying extra fats, but also in women, we often see polycystic ovarian syndrome or PCOS, which is characterized by irregular menstrual cycle and excessive androgen hormones levels driven by elevated insulin in the bloodstream. And of course, last but not least, type 2 diabetes. Good news, insulin resistance is reversible, and so all the conditions mentioned above are preventable. The best treatment for insulin resistance is also the best treatment for being obese and for everyone in general. In short, weight loss through diet and exercise. And now let's have a look together on how we can implement it. It has been proven that fasting optimizes glucose uptake and utilization by the cells, increasing insulin sensitivity. It does that via genetic pathways. Little heads up. If you are a newbie, do not jump on the bandwagon and start fasting from dawn to dusk. Do it slowly and look out for medical advice. Another good tip is reducing the intake of simple sugars, especially from sweet drinks, and incorporate into your diet insulin sensitizing foods such as soluble fiber like flax and chia, that slow down the absorption of glucose. Omega-3 fatty acids melt into the cell membrane, making it more fluid, and thanks to that, the cell is more likely to take up nutrients such as glucose. Another good nutrient is magnesium, 400 to 800 mg a day. Magnesium, besides many other metabolic functions, is involved in insulin-regulated pathways. There are some so-called superfoods that are particularly interesting when it comes to dieting. Ginger contains some components that increase the upregulation of GLUT4 on the cell membrane. GLUT4 is a receptor that is in charge of taking up glucose into the cell. In other words, ginger allows more doors to open when glucose comes around the cell, optimizing its uptake. Another one is cinnamon. Cinnamon contains a particular component that mimics insulin in the body, and a simple way you can incorporate cinnamon into your diet is, for example, adding it into your coffee. Another effective way to increase your insulin sensitivity is through resistance training. Resistance training usages glycogen, which is the form of stored carbs in our muscles. So your body has to replenish it by uptaking glucose from the bloodstream. Moreover, resistance training optimizes utilization of fatty acids. Another point of research that nowadays psychologists as well as dietitians are investigating is mindful eating. In fact, slow and mindful eating is a component of an appropriate diet for insulin resistance because it helps the digestion of complex carbs. In conclusion, what's the takeaway for you today? As a primary and common cause of metabolic diseases, insulin resistance should be considered a therapeutic target. Fat accumulation in the liver is a critical factor of developing insulin resistance. Taking up good eating habits such as fasting, avoid snacking, adding food like cinnamon, ginger, salmon, nuts, and soluble fiber can make a huge difference. Regular resistance training boosts your muscle mass, which is an insulin sensitizing tissue. And slow and mindful eating helps the digestion and the sensation of satiety.
That's all for you today. I hope you enjoyed the video. And if you're new here, do not forget to like and subscribe to the channel so you won't miss another video from me. And remember, stay strong, stay healthy. See you guys very soon. Bye.